Late at night, Shumi is struggling with severe labor pain. Along with this, she is also bleeding. Her close relatives and neighbors are trying for the delivery, but none of them has thought of taking her to the hospital. The situation gradually kept getting worse. There is no money, no transport to take her to the hospital. Many difficulties are there. And at last, when everything was arranged, Shumi was no more alive. Her unborn child too could not see the light of this world. This is a common scenario in Bangladesh. Each and every day, numerous Shumis and their unborn babies are facing untimely deaths in a similar manner. And most alarming of all is that the number of maternal deaths on an average is approximately 12,000 per year. In Bangladesh, a country with an area of 56,000 square kilometers, frequent natural disasters and the stress of rapid population growth are pushing a segment of the population into extreme poverty. Unable to cope with this poverty, a certain group of the population is migrating to the urban areas for a better livelihood. These underprivileged, poverty-stricken people are taking shelters in various slum areas in the cities. It is noteworthy that 1/3 of the urban dwellers live in these slums. Here, even their fundamental rights are denied. The people here are deprived of some of the most basic rights, such as access to pure water, sanitation, education, etc. In the urban areas, the high costs of living have kept proper healthcare facilities out of their reach. Hence, even though there are government and NGO healthcare facilities available nearby, the slum dwellers are not able to take advantage of them. 80% of deliveries in slum areas take place at home and mostly in the hands of untrained birth attendants. The unavoidable outcome of this has been an increase in the maternal and child deaths in the country. Along with the government of Bangladesh, Brac has also come forward to combat these problems with other fundamental issues. Brac has been working all over the country since 1972 for the advancement of the impoverished. Through the implementation of various nationwide program activities, Brac has been successfully working for the economic emancipation of the poor, women's empowerment, establishing justice and good governance, ensuring education and healthcare, as well as many other initiatives to stop social injustice and disparity. At present, around 10 crore people are getting benefits from Brac's various programs. In an effort to continue this, Brac has undertaken a project called Manushi for addressing health of deprived mothers and children living in urban slums. Brac has expressed its solidarity with the national commitment to achieve the Millennium Development Goals by reducing maternal mortality by 3/4 and child mortality by 2/3 by 2015. The prime goal of Manushi is to reduce maternal, neonatal and child mortality by providing integrated health services through a coordinated community-based health program in the urban slum areas. This project is being implemented to cater to 8 million urban slum dwellers. Manushi is providing necessary health services to pregnant women, postpartum mothers, neonates and under 5 children. The objectives of this project are, among the urban slum dwellers, to increase awareness about maternal, neonatal and child health, to ensure health facilities by developing skill of the health workers, to involve community people with the project to strengthen the healthcare system, to consolidate the referral system with government and non-government health centers and keep them effectively functioning, to implement and expand the GO and NGO initiatives. Noor Jahan Begum is a Shastha Shebika of the Manushi project. Shastha Shebikas, like Noor Jahan, go from house to house in the intervention area, identify pregnant mothers, attend delivery and give essential newborn care, advise for taking special care of low birth weight babies, and gives treatment for diarrhea and ARI in children and provide drugs to adult tuberculosis patients. Besides, they also give treatment for some other common diseases. The principal responsibilities of a Shastha Shebika are thus: to identify suspected pregnancy, to offer essential newborn care, to take special care of low birth weight babies, to diagnose and provide treatment for diarrhea and acute respiratory infections, to provide family planning services and sell health commodities, to give treatment to tuberculosis patients, and to give treatment for general diseases. In the project intervention areas, one Shastha Shebika is responsible for taking care of 200 households. A Shastha Shebika, on an average, visits 10 houses every day. The selection criteria for Shebikas are: a member of Brac village organization, married, aged between 25 to 35 years, age of the last child over 2 years, willing to provide voluntary services. After getting proper training, Shastha Shebikas start working in their respective areas so that they can serve their mothers, newborn babies and children without delay in case of emergencies. A Shastha Kurmi is assigned to supervise the work of the Shastha Shebika. For every 2,000 houses or 10 Shastha Shebikas, one Shastha Kurmi is assigned. Along with collecting the pertinent information from the Shastha Shebikas, the Shastha Kurmi confirms pregnancy and registers pregnant women, gives basic antenatal care, weighs newborns within 24 hours of delivery, gives postnatal care for mothers and newborns, gives essential newborn care, and refers to appropriate health facilities in case of any complication. The main responsibilities of a Shastha Kurmi are: to confirm pregnancy and enroll pregnant women, to provide antenatal care ANC, to take the weight of the newborn babies within 24 hours of delivery, to provide postnatal care PNC to the mother and newborn, to provide health care to under 5 children, to refer to the appropriate health facilities in case of complications. A delivery center has been established for every 10,000 people in Manushi intervention areas. These delivery centers maintain privacy and dignity and immediately diagnose complications and arrange their referrals to hospitals. At these centers, 2 trained birth attendants are always prepared to attend delivery. These birth attendants are experienced, willing to work and selected from the community. They assist in delivery, provide essential newborn and also identify complications and arrange appropriate referrals. The community midwives supervise and support the birth attendants. The health workers organize meetings with the 8 to 9 month expecting mothers to prepare them for safe motherhood. Two committees, MNCH and Mother Support Group, have been formed by including members from the community. These members facilitate the Manushi activities in various ways to ensure maternal and child health care. In addition to save lives of mothers and children, Manushi also involves local pharmacists, imams, Kobiraj and other alternative health care providers. Unfortunately, in spite of having all those activities, many slum dwellers are neglectful to seek timely health care. Folk music and street theatres are thus being performed to increase health awareness among slum dwellers in order to ensure health care for mothers and children. To save lives of mothers and children, Manushi has developed an effective referral system with government, NGO and private hospitals. This creates space to offer quality service within shorter time.